In today's video, we are going to be looking at drug potency, drug efficacy, and the therapeutic index. I already made a detailed pharmacodynamics video explaining these three concepts. You can check the link in the description below. Now, we are going to be looking, of course, at some of the key things that you'd need to know when it comes to these three concepts. Now, a quick recap that for a drug to work, it needs to first bind to certain receptors to elicit its biological activity or to produce a biological response. These receptors are very important, of which any drug or any molecule that is inside the body binds to. A receptor is a specialized target molecule that binds to a drug and mediates or elicits its pharmacological action. These receptors may be enzymes, carrier proteins, nucleic acid, or a specialized membrane-bound proteins. Now you can see that there are basically some drugs that bind to receptors and they elicit a biological response. They are called agonists. And there are some drugs that bind to receptors and they block or they don't produce any biological response. They are called antagonists. The graph below shows that this is our maximal effect or maximal response produced at different concentration of the drug. So this particular curve here is a sigmoid curve because it is plotted in its logarithmic function. If you have to plot this graph on a normal scale, it's going to give you a rectangular hyperbola, something like this, to show you that an increase in the dose of the drug increase the effect or increase the concentration produced. Now, this is in the case of a full agonist. Let's look at efficacy and potency, our business for today. Now, these terms are basically used and they are very confusing among students. Most times they can be used interchangeably, but they are actually different. Efficacy is the maximal response a drug can produce. Some drug can be 100% efficacious, as in the case of full agonist. Some drugs can be less than 100% efficacious, that is of partial agonist. Some drug can be not efficacious at all. Some drugs can produce negative efficacy. We are going to delve deeper into that when it comes to agonists and antagonists. Now, potency is a measure of the dose that is required to produce a response. One of the difference between efficacy and potency is that efficacy is basically talking about the concepts, talking about the maximal response that a drug, the highest kind of response that a drug can produce. While potency is as a measure of the dose, the amount, the concentration that is needed to produce a given response. Now, let's take, for example, I have three drugs. I have drug A, I have drug B, I have drug C at different concentration or at different doses. Now, concentration and doses are actually the same things, but we normally use concentration when we are dealing with experimental work or bench work, as in working in the lab, and we use those when we are dealing with real life population. So I'm going to be using the word, they just mean the same thing. Now, if I have three classes of painkillers, I have drug A, drug B, drug C that are of different types, and at different dose, they reduce pain at equal efficacy. That is, drug A 10 milligram gives complete or 100% pain reduction. Drug B 20 milligram give 100% pain reduction also. Drug C 30 milligram also gives 100% pain reduction. Now, this drug A, drug B, drug C, are of the same efficacy. So I'll denote the efficacy by E. Their efficacy is the same. Efficacy of A, the same efficacy of B, the same efficacy of C. These drugs are of the same efficacy. The only difference is that the dose at which they produce this given response are different. This 100% reduction in pain are different. So the more potent drug is that one that is of lower concentration and still produced 100% complete reduction of pain. So drug A is of high potency. Drug A, I'll write for P now. Potency, drug A is more potent than drug B, more potent than drug C. Now, if you have to denote this on the dose response curve, like I said already, that I have a detailed video explaining pharmacodynamics on potency, efficacy, and therapeutic index. But let me just quickly denote this on the dose response curve. The dose response curve just shows is a graph that is used in pharmacology or pharmacodynamics that shows the relationship between dose and the response produced in a given population or in an experimental work. And here we have the efficacy on the y-axis and the dose on the x-axis. Now, if I'm going to use a sigmoid curve, that means I'm going to plot this graph based on their logometric function or their logometric scale. I will have a sigmoid curve, and I have, let's say, this is for drug A, this is for drug B, this is for drug C. As much as possible, I'm trying to make this, they are of equal efficacy. They have 100% efficacy. You can see here, 100% efficacy. But the dose, now don't forget that this is the y-axis, which is the Emax, showing the maximal response or the maximal effect. This is the x-axis, which shows the log parameters, but that's the dose. Now, don't mind my dose response curve, just trying to show you something here. Now, plotting the potency, you can see that drug A is more directed towards the right. That's drug A is more potent. It has lower concentration or lower dose as compared to drug B, as compared to drug C. Now, before we talk about therapeutic index, you just need to know that potency, like I've explained in my detailed video, is mostly expressed as the dose of a drug that is required to achieve 50% response of the desired therapeutic effect. This is what we refer to as the effective dose, ED50. The effective dose is the dose of the drug that is needed to produce 50% desired therapeutic effect or 50% therapeutic effect in a given population. While we also have what we call the LD50 or the TD50. That brings us to the topic of therapeutic index. Therapeutic index is a measure of drug safety. A drug with a higher therapeutic index is safer than one with a lower therapeutic index, and it is denoted by TI or TD, any of which you want to call it. Therapeutic index is the ratio of LD50 over ED50. Now, LD50 is the lethal dose that produce 50% lethal response or 50% death response in a given population. While ED50, of course, we already explained, is the effective dose that produces 50% of the desired therapeutic effect in a given population. Now, the ratio of LD50 over TD50 gives us the therapeutic index. Now, if you can see from this dose response graph, the dose that is needed to produce 50% therapeutic response in the given population is what we call ED50, as you can see from this. While if you are to increase the dose, you are going to get to a particular phase or a particular dose that will still produce that same given effect, that same 50% response in a given population, but it is at a higher dose. because of an increased dose from ED50 to LD50. And now the ratio between these two given data point is what we call the therapeutic index. As you can see, Ti is equals to LD50 over ED50. LD50 is 100, ED50 is 10. And we have our Ti to be 10, which means the drug is safe. And here we can see that the drug has a good therapeutic margin. The margin between the effective dose and the lethal dose is wider. It is not narrow. Now let's take some questions. Study the graph shown and the following questions given below. Find the effective dose, toxic dose, therapeutic index, and what is the difference between therapeutic window. And I meant to say difference between therapeutic window and therapeutic margin, or even therapeutic index. Now, of course, finding the effective dose, of course, the effective dose is this because it's closer to the right. That is the lower dose. This is the ED50. So I'll just put it here, ED50. The toxic dose, of course, is this. This is the LD50. Now, most times you are going to see the word LD50 and CD50. It means the same thing. LD50 is the lethal dose that produces lethal effects at 50% of the given population. CD50 is toxic dose that produces toxic effects at 50% of a given population. The only difference is that one is lethal and the other is toxic. Of course, the ultimate goal of any toxicity is death. That means you can use it. You can use them for the same thing. You can use them for the same um, definition. Still means the same thing. But the therapeutic index in this case is 0.1 divided by 0.01. That's the LD50 over ED50, and the answer is 10. So the TI is going to be 10. Now, what is the difference between therapeutic window and the therapeutic margin? Therapeutic window just shows the range at which a particular drug in the bloodstream is going to produce its desired therapeutic effect. While a therapeutic margin shows whether there is, in the dose response curve, if there is a wide margin between ED50 and LD50, or if there is a narrow margin between ED50 and LD50. And of course, we know the therapeutic index, the ratio that's the quantitative ratio that helps us determine the safety, and it is denoted by LD50 over ED50. Now, I want you to do this question by yourself. The given dose response graph below shows drugs that are used for treating various conditions. Which of the following drugs are safe to use and why? So observe this particular graph and comment your answer. Which of these following drugs are safe to use and why do you think they are safe to use? Thank you. Don't forget to like, subscribe, share if you found this video helpful. And don't forget also to watch the detailed video on dose response curve that is fully explained.